Right now, millions of seniors over 60 are taking their blood pressure medication every morning. After taking it, they measure it again, see a beautiful number, and feel reassured. But I have to be honest with you. There is something silently happening inside your blood vessels, in your brain, and in your kidneys that beautiful number does not warn you about. It is not because you are careless, nor because your doctor did something wrong, but because many people have never been told that the number written on that prescription was calculated for a body 20 years younger than yours. If you are over 60 and taking your blood pressure medication regularly, I need you to listen to this entire video, because there is something happening that your routine physical exam is failing to detect. It does not come from high blood pressure. It comes from blood pressure being forced down too low for a body that is 60 or 70 years old. And the scariest part is, it doesn't cause any pain. It only makes you feel slightly lightheaded in the morning, a bit dizzy before your first cup of tea of the day. Maybe you just have to hold on to the handrail for a moment when walking downstairs. You think it's a sign of old age? It is not. By the end of this video, you will know exactly what it is, why it happens, and what you need to say to your doctor before your next follow-up appointment. I am therapist Judy Byington with over 10 years of experience in the field. The question I want to answer today is one that most seniors over 60 have never thought about. Not what is my blood pressure, but what blood pressure is truly right for a 60 or 70-year-old body with 60 or 75-year-old blood vessels. The answer is not always 120/80, and I am going to prove it to you. Very few doctors have a full 10 minutes during a checkup to explain this to you. This could be the most important thing regarding your cardiovascular health right now. I will explain it thoroughly in the middle of the video. Do not skip that part. To understand why the number on your prescription might no longer be right, we have to go back and see where it came from. The 120/80 standard that almost everyone memorizes was not studied on older adults. It was built primarily from studies on people in their 40s and 50s. Then it was applied universally to all age groups, as if a human body at age 45 and age 72 were no different, when in reality they are vastly different. For a 45-year-old, that logic is absolutely correct. The lower the blood pressure, the less pressure the blood vessels have to endure, and the lower the risk of heart attack and stroke, because their blood vessels still have good elasticity and remain pliable. But here is what they missed. After age 60, your blood vessels change. Not because you are eating wrong, not because you are lazy to exercise, but simply because of age. A substance called collagen gradually builds up in the vessel walls. Calcium deposits over the years. The blood vessel lining, which was flexibly elastic at age 45, now gradually stiffens. Your blood vessel changes from a flexible conduit, like a garden hose, into a rigid pipe. And a rigid pipe requires stronger pressure to push blood through, especially since blood must travel upward to the brain against gravity. This is not a disease. This is a normal aging process that is clearly documented in medical literature. And when medicine applies a blood pressure target designed for the elastic blood vessels of middle age onto the stiffened blood vessels of a 65 or 70-year-old, the consequences are real, measurable, and in many cases, difficult to reverse. The new 2025 medical guidelines from the American Heart Association recommend a target under 130/80 for most adults. This is solid evidence at the population level. I do not deny that. I still use it as a starting point, but for a significant portion of people over 60, especially those who are frail, those who have a history of falls, those with visibly stiffened blood vessels, or those who often get dizzy when standing up, forcing it down to that number creates a completely different problem. I want to tell you about a patient I will call Joan. Joan, 71 years old, a retired teacher, lived a very disciplined life and was very careful with her health. Every morning she walked around the neighborhood, cooked for herself, took care of herself, and attended regular health checkups without missing a single appointment. By all standards, she was a model patient. Her blood pressure previously hovered around 148/84. Following the current standard protocol, her treating physician added a second blood pressure medication to bring the number closer to the 130 target. 6 weeks later, her blood pressure measured 118/72. The doctor was very pleased. The number had improved and the medical record looked beautiful. But Joan did not feel well. She came to see me because she didn't know what to call her sensation. It wasn't exactly an illness, but every morning she felt a mental fogginess, a feeling she had never experienced before. She nearly slipped twice on her front steps in just 2 weeks. Every time she stood up from a chair, she felt slightly dizzy. She had silently given up her morning walks because she no longer trusted her legs on the sidewalk. 3 previous doctors had told her, "This is normal. Everyone gets like this when they grow old." Those 3 doctors looked at the record, saw a blood pressure of 118/72, and concluded she was very well controlled. When I measured her blood pressure while she was lying down and then remeasured it immediately after she stood up, a test that takes less than 3 minutes but is rarely performed during a routine checkup, I discovered her systolic blood pressure dropped by 24 points within seconds of standing up. 24 points. This is called orthostatic hypotension. Every time she stood up, her brain was deprived of blood for a few seconds, which no one had ever detected because no one had ever looked for it. We adjusted her medication, coordinating with her primary doctor to bring her blood pressure target back to what fit her real body, not the average of someone 20 years younger. Just 2 weeks later, the morning fogginess disappeared, the dizziness stopped, and she went back to her morning walks. At her follow-up visit, she told me something I will never forget. The number on the machine looks better, but I felt like I was slowly disappearing. I thought it was just the feeling of getting old. That is not the feeling of old age. That is an incorrect blood pressure target placed upon an unsuitable body. And Joan is not the only case like this I have encountered. Now I will explain the science behind Joan's story. This is the part few people take the time to explain thoroughly, and this is the part that will change the way you look at every blood pressure reading from now on. It all starts with the J-curve. When researchers plot the relationship between blood pressure and cardiovascular risk, people expect to see a straight line. The higher the blood pressure, the higher the risk. The lower the blood pressure, the lower the risk. Simple, easy to understand. But actual data in older adults produces a J shape. The risk gradually decreases as blood pressure drops from excessively high levels. This is as predicted. But below a certain threshold, the curve begins to bend upward again, and the risk increases. The graph forms a J shape. Many large-scale studies have confirmed this pattern. One analysis showed that the risk of cardiovascular mortality associated with low diastolic blood pressure, meaning the bottom number, is most visibly concentrated in the group over 60 years old. When the bottom number drops below 70, the risk increases significantly. Why is that? The pause between 2 heartbeats, when the heart dilates to pull blood in, is precisely when the coronary arteries, the primary blood vessels nourishing the heart itself, receive most of their blood supply. If the bottom number is pushed too low, the heart will be deprived of nourishing blood right while it is resting. Not enough to cause an immediate heart attack, but enough to accumulate silent damage month after month, year after year. And here's the part that almost no one mentions when talking about blood pressure: blood vessel stiffness. In young people, blood vessels are still elastic and act as a cushion. The aorta dilates to absorb the surge of blood from each heartbeat and then contracts to maintain a stable pressure between beats. It is that elasticity that keeps the bottom number stable. In older adults, the blood vessels have stiffened, their ability to contract weakens, and the aorta no longer recoils as it used to. The top number increases because the rigid vessel wall cannot absorb the surging blood. The bottom number decreases because there is no longer enough elasticity to maintain pressure between beats. The gap between the top number and the bottom number grows wider and wider. This is one of the most reliable signs that blood vessels are aging. This is why this matters to anyone taking blood pressure medication after age 60. Most blood pressure drugs are designed to lower the top number. That is the primary function of the medication. But on a vascular system that is already stiff, with a bottom number that naturally decreases with age, using medication that is too strong can push the bottom number down to a level that reduces blood flow to the heart, reduces blood flow to the brain every time you stand up, and causes the kidneys, an organ that requires adequate pressure to filter about 200 liters of blood per day, to gradually and silently lose function without any warning symptoms. A study at a dedicated blood pressure center showed that a diastolic pressure below 80 was associated with a 33% increase in the risk of cardiovascular events, including myocardial ischemia and heart failure in patients being treated for high blood pressure. That is not a small number, a 33% increase in risk among patients whose medical records explicitly stated their blood pressure was well controlled. The brain suffers a similar impact. Multiple studies have shown a clear link between stiff blood vessels, reduced blood flow to the brain, and cognitive decline. When stiff blood vessels fail to deliver enough consistent blood to the small vessels in the brain tissue begins to degenerate gradually. The ability to concentrate decreases, reflexes slow down, and memory becomes less reliable. Because this process happens slowly over many years, most people, including many doctors, attribute it entirely to old age. But that is not entirely the case. A significant portion of what is called senile confusion is actually related to blood vessels, and part of that damage comes from blood pressure being pushed lower than an aging vascular system can safely tolerate. This is the middle of the video I promised you from the beginning. This part will change the way you look at every blood pressure reading from now on. Before I go on to discuss specific numbers and the 3 questions you need to bring to your doctor, I want to ask you one thing. Every time your doctor measures your blood pressure, do they measure it while you are lying down and then measure it again right after you stand up? Yes or no? Please leave your answer right below in the comments section to help me. Because in my experience, most seniors over 60 have never had it measured that way during the same checkup. I read every single comment. Your answers will help me know what to make the next video about. So after age 60, what blood pressure should you aim for? Here's the most honest answer that the best doctors will tell you, and it is also the one I tell my own patients. It depends on each individual's body. It might sound like a generic answer, but it isn't. It depends on very specific factors, and when you clearly understand those factors, you can talk to your doctor proactively instead of just accepting a pre-printed number on a prescription. For the majority of seniors aged 60 to 75 who are still healthy, can walk independently, have no history of falls, and show no signs of dizziness upon standing up, a target below 130/80 according to the 2025 guidelines has a completely solid scientific foundation. Many large studies have confirmed that achieving this target helps reduce strokes, heart attacks, and cardiovascular mortality in this group. If this applies to your situation, that target is protecting you. No further debate needed. But for seniors over 75 or anyone over 60 who frequently experiences dizziness or lightheadedness when standing up, has fallen in the past year, has visibly weakened health, or notices worsening memory, the picture is much more complicated. The European Society of Hypertension guidelines, which apply targets by specific age groups, recommend a level of 130 to 139 for people aged 65 to 79, and allow a level of 140 to 150 for those over 80 or individuals in frail health. This higher level is not careless treatment. It is medicine tailored to real physiology, based on what a stiffened vascular system actually needs to operate safely. The most important number that almost no one monitors is not the number measured at the clinic, but the difference between your blood pressure when lying down and when standing. If the top number drops by more than 20 points right after standing up, that is the medical definition of orthostatic hypotension. This condition affects 10% to 30% of older adults. A study of 49,000 people confirmed that this condition increases the risk of falls by 73%. And falling for someone over 60 is no small matter. A hip fracture at this age is associated with a 5-fold increase in the risk of mortality within 1 year. This is not a rare statistic. This is the daily consequence of a blood pressure target applied without considering what happens the exact moment a patient stands up from a chair or bed. Think back to those moments. Waking up in the middle of the night to use the restroom, squatting to pick vegetables in the garden and then standing up, or sitting watching TV and then standing up to get water, those are precisely the moments where orthostatic hypotension silently poses the greatest danger because no one is prepared for them beforehand. This is what I want you to write down before the video ends. 3 questions to bring to your next checkup. Read them straight from your phone if necessary. Question 1. Doctor, can you measure my blood pressure while I am lying down and then measure it again right after I stand up to check if I have orthostatic hypotension? This test takes only 3 minutes, but it detects what a single sitting measurement will never show. Question 2. Given my age, the condition of my blood vessels, and my symptoms, what blood pressure is appropriate for me personally, rather than just according to the general average? This question shows the doctor that you understand individual differences. It opens the door to personalized treatment. Any good doctor will welcome this question. Question 3. Among the medications I am currently taking, are there any that could cause dizziness, lightheadedness, or confusion? Orthostatic hypotension in older adults is often caused or worsened by the medications themselves. Diuretics, beta blockers, calcium channel blockers, ACE inhibitors, and certain antidepressants all carry this risk, especially when multiple types are used together at the same time. Your entire medication list deserves to be looked at holistically by someone, rather than just examining each type individually. 3 questions, 1 checkup that can change the quality of your health care for years to come. Joan came back to see me after 4 months. She hadn't fallen a single time since. The feeling of dizziness upon standing had completely vanished. She walked regularly every morning for 45 minutes along the exact same familiar route she had taken for years. And that feeling of mental fogginess, which she had silently accepted as a part of old age, had completely dissipated. Her blood pressure at that time measured around 138/76, not 118 like before. Not the number the original doctor was pleased with, but the right number. The number that allowed her real body, her 71-year-old blood vessels, and her aging but still well-functioning cardiovascular system to deliver enough blood to her brain, her kidneys, and her heart without causing a mini crisis every time she stood up from her chair. She told me a sentence that I still remember vividly whenever I meet a patient in a similar situation. I had 2 months of feeling like I was slowly disappearing. I thought it was just a normal part of getting old. I want you to hear that sentence very clearly, because there are so many seniors over 60 who are living a life that is dimmer, less sharp, and less steady, while assuming it is all due to age. Yes, part of it is due to age, but a significant, measurable, and improvable portion comes from a blood pressure target that is unsuited to their body, simply because no one stopped to ask the right question. You should not have to feel foggy every morning. You should not have to hold on to the handrail every time you walk down the stairs in your own home. You should not have to hesitate before standing up. That is not the inevitable price of living past age 60. Those are signals, and now you know what they might be warning you about. Before finishing, I want to summarize everything so that you leave with absolute, complete clarity. The truth about blood pressure after 60 is this. The 120/80 standard was built from research on middle-aged people. It is a reasonable starting point at the population level, but it is not automatically right for everyone over 60. After age 60, the natural, gradual stiffening of blood vessels changes the true needs of your cardiovascular system. Your blood vessels can no longer dilate and contract flexibly between heartbeats, which naturally causes the bottom number to be lower. If you use strong medication to force it down even further without careful consideration, your heart, brain, and kidneys may be deprived of nourishing blood precisely when they need it most. The J-curve is a reality documented in medical literature. Below a certain threshold of the bottom number, especially in older adults who already have coronary artery disease or stiff vessels, cardiovascular risk stops decreasing. It can increase again. Orthostatic hypotension, the condition where blood pressure drops upon standing up, affects nearly 1/3 of older adults and is linked to a 73% increase in the risk of falls. This condition is almost never detected unless someone proactively measures it both while lying down and while standing. Please proactively ask your doctor to perform this test. For the majority of seniors aged 60 to 75, a target under 130/80 has a solid scientific foundation. For those over 75 or anyone with a history of falls, frail health, or dizziness upon standing, a target personalized by a doctor who thoroughly understands your condition is not just acceptable, it is essential. Bring the 3 questions to your next checkup. Ask to have your blood pressure measured while lying down and standing, discuss a personalized blood pressure target, and review all current medications to find potential causes of dizziness. Write them down, take them with you, and use them. Now, I truly want to hear from you. Have you ever felt dizzy, foggy, or unsteady and simply thought it was due to old age? Has your doctor ever measured your blood pressure in both positions? Please leave your answers below to help me. I read every single comment, and what you share will help me decide the content of the next video. If this video brought you something useful, please help me share it. Not for the sake of my channel, but for your loved ones, the people over 60 who regularly take their medication every morning, whose numbers look perfectly fine on paper, but who might not know that being fine on paper does not necessarily mean being fine in reality. A single share from you could matter more than you think. Subscribe to the channel to follow more honest insights about health after age 60. In the next video, I will talk about the blood pressure medications most commonly prescribed to older adults and their side effects on the heart and memory that almost no one is warned about before receiving the prescription. You will want to hear that before your next follow-up appointment. One final thing I need to make clear. Everything I shared today is based on published medical research and my clinical experience, but everyone's condition is different. The medications you take, your medical history, and your unique body chemistry are completely individual. Please absolutely do not adjust or stop any medication on your own based solely on what you heard in this video. Take these 3 questions to your own treating physician. Have an open, face-to-face, unhurried conversation with your doctor. That is where truly good medicine begins. I am therapist Judy Byington. I wish you to always understand your body, always stay proactive in your healthcare, and always cherish the body that has accompanied you through so many years.